Today I'm going to tell you about an exciting study that looks at the effects of a type of cognitive behavioral therapy on irritable bowel syndrome, or IBS. I'll start with a little bit of background on what is irritable bowel syndrome, or IBS. Well, it's primarily a functional, non-organic gastrointestinal, or GI disorder that's characterized by altered gut motility in the form of predominating diarrhea or constipation, along with abdominal distension or bloating, in addition to abdominal pain. And when I say functional and non-organic, functional refers to the fact that in an organic gastrointestinal disorder, such as celiac disease or Crohn's disease, physicians will be able to take a biopsy via upper endoscopy and see damage in the form of different types of intestinal manifestations on the biopsy versus a functional GI disease such as IBS, in which there's no physical manifestation of the symptoms. Yet patients are still experiencing quite intense abdominal pain and associated symptoms. And so just out of curiosity, do any of you know someone with IBS? So a lot of you raised your hands, and that's not unsurprising. And that's not surprising, rather, considering that IBS affects nearly 35 million Americans worldwide, or about 10 to 15% of the population. And so why is cognitive behavioral therapy a good and effective treatment for IBS? Well, as I mentioned before, there's no physical intestinal manifestation of IBS, and so there aren't many great treatments. However, IBS does show a great manifestation of the mind-gut connection and the way in which the brain and the gut interact, as shown in this diagram here. And so in IBS, the central nervous system of the brain and the enteric system of the gut communicate via nerve signals, as well as humoral communication via bacterial factors and cytokines. So in addition to that, IBS has been shown to be quite similar to panic disorders and anxiety disorders in the way in which it responds well to exposure therapy, such as that found in CBT. So the study of interest that I'll be talking about today is called a cognitive behavioral treatment for irritable bowel syndrome using interoceptive exposure to visceral sensations. And just to give a little bit of background, when I talk about visceral sensations or visceral anxiety, it's relating to the uncomfortable abdominal sensations and the heightened anxiety that patients with IBS experience to these abdominal pain. This study was published in Behavior Research and Therapy in 2011 and was led by Michelle Krasky and colleagues. So the hypothesis of this study rests on the fact that visceral anxiety has been implicated in IBS, in the finding that interoceptive exposure is likely a good treatment method. So the researchers hypothesized that CBT targeting visceral anxiety through interoceptive exposure will reduce the severity of IBS symptoms and lead to overall better outcomes. In terms of the methods utilized in this study, there were 110 participants at baseline who were then screened and randomized into 3 different treatment groups. Within the 3 groups, the patients met with therapists for 10 weeks for 50-minute sessions. And in the first group, which functioned as the control group, patients received something called attention control, in which they recorded their symptoms and received educational materials about IBS that they then discussed with therapists. In the next group, which is called CBT with stress management, the patients received some similar materials to that as in the attention control group, but they also received some additional exposure therapy to stressful events regarding all of daily life, such as work deadlines or something pretty general like that. And patients were trained in things such as progressive muscle relaxation therapy and things to help them better deal with their anxiety in general life. And the other group was CBT with interoceptive exposure. And so patients received similar materials to the other 2 groups, but an additional component of exposure therapy that was really targeting the IBS-specific sources of anxiety and stress. And so patients were charged to take tasks up, such as tightening their gut muscles, or wearing tight clothing that was pressing on their distended abdomens, or taking long car rides and delaying entrance into the bathroom in order to reappraise situations and realize that and recognize their hypervigilance to such symptoms and find better coping methods for reducing anxiety surrounding these abdominal sensations. So the primary outcomes used in this study were surveys such as the Bowel Symptom Severity Index and a Visceral Sensitivity Index, which looked at the degree of heightened sensitivity to visceral sensations. And so these measurements were taken at pre-treatment, mid-treatment, post-treatment, and at a 3-month follow-up. And so as you can see here in the results, all 3 of the treatment groups and the interventions did lead to a reduction in bowel symptom severity. However, you can see that one treatment, and that's that medium gray line, was superior to the others and showed an even greater decrease in the degree of severe symptoms, and that's CBT with interoceptive exposure. We see something similar in this graph where the outcome is visceral sensitivity index. And again, all 3 treatments are showing a decrease in symptom severity, or rather in visceral sensitivity, but interoceptive exposure, again, is showing a more significant and a more impressive decrease. And so I also have the results just shown in a little bit of a different way here, and this is in the form of effect sizes, just to help you conceptualize how great the difference was between the 3 different treatment groups. And so right here, CBT with interoceptive exposure is compared to attention control at post-treatment and at follow-up. And you can see that there's about a 0.44 or a 44% showing that CBT with interoceptive exposure is about 4.4 times more effective than attention control at post-treatment, and then about 0.7 times, or rather 7 times more effective at follow-up. And right here, CBT with interoceptive exposure is compared to CBT with stress management, and you can see that the effect size is again showing that CBT with interoceptive exposure has a significantly greater effect than CBT with stress management. And right here I have the results again, but with the other primary outcome measure, which is the Visceral Sensitivity Index. And you can see that again, the effect size indicate that CBT with interoceptive exposure is superior to both attention control on the left and CBT with stress management on the right at both post-treatment and at follow-up. So I also wanted to mention some limitations of the study. Well, the study did include a relatively small sample size in the author's view, and they noted in the paper that given a larger sample size, they would have been able to hopefully produce an even stronger result and elucidate even more mechanisms. Additionally, there are no universally utilized scales for measuring IBS symptoms, which isn't a problem very specific to this paper, but rather to the IBS literature as a whole, as it can be difficult to compare the outcomes and the results of different papers. Furthermore, the results are self-reported, which, as we know, can lead to human error, although it would be pretty difficult to find another way to report the results since people are actually talking about their anxiety and their internal sensations. I'd also like to touch on some implications and future directions. So the primary conclusion from this study was that this particular type of CBT using interoceptive exposure was quite effective. And so this shows that it would be warranted to try to disseminate this treatment to a greater amount of patients. However, there are some barriers to doing this, and one of the primary ones being that there aren't many cognitive behavioral therapists or psychologists in general right now trained at the intersection of gastroenterology and psychology. So there's certainly a need for greater training opportunities and greater targeted education in that area so that this treatment can be promoted more widely to patients so they can have greater awareness and hopefully have an improved quality of life. Thank you.